Dr. Steve Fleischer, who's joining us from King of Prussia, because you can help us to figure out how to tell pregnant moms out there how they can get some relief during the summer and also when they're trying to sleep. So thank you so much.
Thank you. Thank you for having me back on the program. It's great to be here.
It's good to see you. And we want to make sure, because you know we're a hands-on group here, that while you're giving us some of these tips that Mike has agreed so kindly to demonstrate and show how you can get it done.
Doctor, we could not find a pregnant woman who wanted to be on the show today. So Kit Kat Klein, our producer, suggested this. I'm telling you, I could never do this. I'm uncomfortable just with this fake belly.
And he's literally had the fake belly on Dr. Fleischer for about 2 minutes. So this is going to go well.
Got it.
So for the first thing, you know, is it just because of the heat and everything that's going on? Is that why everyone says it's so much harder to be pregnant in the summertime?
Well, there's several things that happen when you're pregnant in the summertime, but as the physiology changes, whether it's the summertime or the wintertime, the muscles tend to get into knots, kind of like this. So one of the simple things that we recommend people do to help alleviate some of the discomfort during the summer is to do some simple stretches, which helps get those knots out very gently, which we're going to show you how to do that right now.
Wonderful. Okay, so where do we start? What body part?
So we've got my chiropractic assistant, Rose, with us. She's going to be my model. And we're going to start with a hamstring stretch. So go ahead, bend over. And what you're going to do is you want to do these stretches 1 to 3 times a day. You don't want to bounce with these stretches. You go as far as you can. If you feel pain, come off it a little bit. And you hold each stretch for about 20 to 30 seconds. Now that's for the back of the leg, the hamstring muscles. The next stretch we're going to do is the mid to low back stretch. So you're going to grab your knee, you're going to lean over at the waist, and you're going to raise your back up like a cat stretch. And you're going to feel that whole stretch in there. You feel that, Rose? That feels pretty good, doesn't it?
Looks
okay,
like Mike
so the next stretch we're going to do, yeah, it feels really good. The next stretch we're going to do is the Piriformis Stretch, which is a small muscle across the buttocks here. And when that gets swollen and inflamed, it can cause pressure to the sciatic nerve and give pain down the back of the leg, numbness, tingling, weakness. So Rose is going to demonstrate that now. So she's going to pull up on her knee and she's going to lean in with her chest. She's not going to curl her body, but she's going to lean forward and stretch this muscle back and through here to take out some of those knots to reduce the sciatic pain.
I can't see this.
It's probably easier. So for this one, you need to be seated.
Correct.
Okay.
Correct. You need to be seated for this one. The next one we're going to do are the ranges of motion for the neck, because in addition to back problems, a lot of pregnant women start to complain of neck problems as their body starts to change in shape as the belly starts to get bigger. So there's 6 ranges of motion for the neck, and same thing. Hold each one of them 20 to 30 seconds to do it 1 to 3 times a day. And as you can see, she's demonstrating the last 2 of the stretches, the rotations.
So for the next one,
the
it's
next
just look
stretch
to the
we're gonna
right and then look to the left and make sure you just pause in between.
Correct. You hold each one for 30 seconds, and then
Okay.
you're going to also bring your ear to your shoulder, too, each way, and then you're going to bend your head forward and bend your head backwards. Those are your 6 ranges of motion.
All right.
So the next stretch we're going to do is a hip flexor stretch. So what you're going to do is you're going to lay with one leg hanging off the bed, and you're going to bring the opposite knee in towards the chest, and that's going to stretch the deep hip flexor muscles in through here. It feels really good. It helps to relax a lot of tension on the low back. Okay. So the next thing we're going to do is, if you have a partner that is willing to assist you during your pregnancy and help with these things, I'm going to show you a couple things that a partner can do. So one of them is the hamstring stretch here, where you lean in, you support the knee here and the ankle here, and you don't want to feel the leg shaking, and you don't want to see the knee buckle. If you do, you're pulling too far up.
Okay.
So you want to just let that release. Now, the other thing that my wife had me do for her during her pregnancy was I gave her massages. I rubbed her low back and also rubbed her feet, because they would tend to get swollen especially during the summer. They retain water, right?
Right.
So one of the things that we recommend is we recommend these 2 pieces of produce, cucumbers and watermelons. They are natural diuretics, and my wife lived on them during the summers. I'm sorry?
Nothing.
It's Mike being Mike. Continue, Dr. Fleischer.
So they are natural diuretics. They help to get rid of the water. It really helped her through her pregnancy, especially during the summer with the water retention. So the last thing I want to show you is what do you, I'm sorry?
You said you eat them, or you're saying that you use it to rub? I missed it, sorry.
Oh, no, I'm sorry. No, you eat them.
Okay.
You eat them
Well, I
because
didn't know. I mean,
they're
you could
natural
roll it up and
diuretics.
down the back. I wasn't sure. So, okay. Thank you for clarifying.
Well, they
I
have
got a
foam
watermelon.
rollers for that.
Yeah, that's true. They do. They do, which are similar shapes when it comes to cucumbers, a little bigger. But, hey, those are great summer foods to eat, nice and cool. And what was the last thing?
Yes. So the last thing we're going to talk about is sleeping postures. I've been told it is incredibly uncomfortable during the late second and third trimesters to sleep on your back or on your stomach. So we've got this pregnancy pillow that we have right here, and Rose is going to demonstrate how to use that. It'll support the neck, it'll support the stomach, and it supports the legs so that there's no stress on the low back when you're sleeping, and it lends for a very comfortable and restful night's sleep. Well, as best as you can get during late pregnancy.
I need one of
Wonderful.
those.
Yeah, that looks very comfy. Thank you so much, Dr.
It is very
Fleischer. Can you do too many at once to pace yourself, or every day?
No, you just want to go through it nice and slowly. There's no rush. Again, you want to make sure that you're breathing slowly through it, and there really shouldn't be any pain. If you're having any pain during your pregnancy, then you definitely want to get to see a chiropractor to make sure that we can find out what's going on and help you have a very happy pregnancy.
Wonderful. Thank you, Dr. Fleischer, for those tips. I'm sure it'll bring lots of relief to lots of people. I don't know about for Mike Jarek over there, but maybe for others.